We continue our series of courageous conversations.
Today at 4, we're shining a spotlight on disparities in healthcare. 10 on your side's Lex Gray talks with a midwife working toward change.
When I had my son 1 year ago, I was fortunate to be well taken care of by a team of doctors and midwives. But I'm white, and so are the majority of my providers, and we live in a country where that still makes a difference. Sometimes the difference between life and death. The CDC reports that black women are 2 to 3 times more likely to die from a pregnancy-related cause than white women. Here's how a local midwife is working to be a part of the solution to that problem.
I didn't start off planning on becoming a midwife.
Victoria Buchanan started as a labor and delivery nurse. What she saw disturbed her and drove her to do more.
I also saw some significant disparities between the experiences that African American women would have. I had a patient come in who was having problems with possible preeclampsia, and they thought that, oh, maybe she had drug problems and that would delay her care. But when they finally did figure out that, oh, it wasn't that, it was that bias that affected her outcomes.
Buchanan saw that and wanted to change it.
And I knew as a labor and delivery nurse, I was only able to affect change to a certain degree, and that wasn't enough for me.
So she turned to midwifery.
When I first started telling people I was going into midwifery, they would first say, oh, Jay still exists, or is that even legal? Now I'm seeing more and more people pursue midwifery care, and more African Americans are seeking that level of care.
Buchanan believes that diversity among healthcare providers is just one of the ways to combat bias within the field.
I'm hoping that one day that the demographics of midwifery will mirror the great diversity we have here in Hampton Roads. Seeing yourself and your healthcare providers is really important.
But the job of confronting biases doesn't stop there. Buchanan says providers need to make sure they're examining how they treat each patient.
If you recognize that you're treating people differently, address it and then do the work to eliminate the change in the way you do your care. You should give the same care to everybody.
As for patients, Buchanan wants them to know their rights and know this.
Every woman deserves respectful maternity care. Doesn't matter what they look like, where they come from, or what their socioeconomic status is.
If you'd like to read more about how Virginia representatives are working to address disparities in maternal care, look for this story on WAVY.com. I'm Lex Gray, 10 on your side.